To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hi, and welcome to Your Health. Today we're going to talk about osteoarthritis, and to help us with that topic we have Dr. Delo from Delo Sports Medicine. All right, so there's a couple of types of arthritis, and you're going to tell us a little bit about both of them and then exactly what osteoarthritis is.
Okay, there are two main types. One are the inflammatory arthritis processes, like rheumatoid arthritis. That is a different autoimmune category.
Okay.
And then there's osteoarthritis, which for many years we always just called wear and tear arthritis. However, we're learning more about osteoarthritis that, okay, not everyone is necessarily going to get this, that there are many predisposing factors and things that maybe we can control.
Okay, so what are some of the risk factors that could lead to osteoarthritis?
So biomechanical loading is one of them. We talk about a joint, a special area of the joint is not loading properly. That can be due to favoring one side or to having a procedure or surgery done somewhere else and just not walking abnormally. And those biomechanical imbalances can be corrected, sometimes with chiropractic, sometimes with therapeutic exercise, or bracing or taping if necessary. Other risk factors are weight. You know, obesity definitely overloads our joints, and that can lead to more stress on the joint. And that can often be helped with either medication management or dietary changes. Injuries accelerate the process of arthritis.
You're hurt on this side, so you start limping a little bit, or you're a little crooked when you walk, so so those injuries, that can kind of lead to that.
Yeah, and especially in young people, we see ACLs, unfortunately, that tear. We know those kids are gonna have arthritis in about 15 years. You know, what can we do to try to intervene? There's wonderful injury prevention programs now, gyms and apps even, that will teach you different exercises to decrease the risk of some of these catastrophic injuries, and that, of course, can help. And then things in our environment, you know, trying to get rid of chronic inflammation, toxins, smoking, diets that aren't healthy and can actually damage us on a cellular level.
Definitely. All right. So now, once upon a time we thought of this as aging, right? So we can't stop the aging, but we can do things to help prevent the osteoarthritis from being as bad or just even coming, right? So talk about a little bit of your treatment.
Sure. It has been proven that mild to moderate exercise slows the process of arthritis. So getting blood flow to those joints, moving those joints.
Get going, right?
You know, sleeping well, decreasing stress. And then if arthritis presents, then really getting seen earlier, because we can halt the progression of that arthritis if we catch it in a mild to moderate stage. And in the regenerative medicine space, things like PRP and stem cell treatments have been proven to halt arthritis, again, if it's not severe.
Great information as always. Thanks so much, Dr. Delo, and thanks to you for watching To Your Health.
The preceding was a paid advertisement.